Hello everyone, I'm Dr. Madhu Goel, Senior Gynaecologist and Obstetrician, and today we are going to talk about something which is very important, and that is surgical abortion. Now, as we discussed in the last video, you have two options to terminate a pregnancy. It can either be through tablets, which is called a medical abortion, or it can be a surgical procedure, which is called a suction evacuation or a dilatation and curettage in medical terminology. Now, whether you want to undergo a medical abortion or surgical abortion is entirely your choice. Normally, for an early pregnancy, medical abortion is fine, provided you have the patience, you understand that there is a waiting period for 2 weeks. However, if you are someone who cannot withstand pain, who wants an early termination, who does not want the fuss of waiting, then surgical abortion is the method of choice. Also, unlike medical abortion, which can only be done in early pregnancy, surgical abortion can be done safely till about 12 weeks of pregnancy. Once you have decided for a surgical abortion, it is done in the hospital. It requires a daycare hospital admission. You are asked to come fasting, which means you will not have anything to either eat or drink for the last 6 hours. We admit you in the hospital. Before the surgery, we do certain blood tests like your blood group, hemoglobin. Sometimes a viral marker is required like hepatitis B, HIV, HBsAg. You may be asked to do a thyroid depending on your personal history. So we make sure that you're fit to undergo the procedure. You are given a choice of opting for the anesthesia that you require for the surgery. It can be a simple IV sedation, or it may be a general anesthesia. Most procedures in our hospital are done under general anesthesia because it is absolutely painless. The general anesthesia is hardly given for 10 to 15 minutes since it's a very small procedure. At the appointed time, the patient is shifted to the operation theatre, and once you are properly cleaned and draped, we introduce a plastic cannula. It is a very small, soft plastic cannula inside your cervix, and we have a machine which creates vacuum, and we do what we call a suction evacuation. That means by the process of creating vacuum, all the products that are inside the uterine cavity get sucked into the machine. Normally, we would advise that we can do an ultrasound check just to make sure that the uterine cavity is completely empty. The whole procedure takes about hardly maybe 10 to 15 minutes. And after the procedure, you are shifted back into the room. It is a very safe process. Like all surgeries, like all medical procedures, it carries a small risk, which may be due to the anesthesia or which may be due to the procedure per se. But normally we've seen that the complication rate of surgical abortion is very, very less. And by the evening, after you are kind of conscious, you're able to walk, you've passed urine, and we are comfortable that you'll be okay at home, we send you home. Post surgery, you are given a course of antibiotics. Painkillers are added so that you are completely pain free at home, and there are a certain set of precautions that we advise you to take at home, which basically means that you should have a healthy diet, plenty of fluids, you should take adequate rest, and you have to come for follow-up after 1 week. I will be talking about the post-abortion care in my subsequent video. Thank you. Hopefully all this information will be useful to you, and if you have any friends, family who require this information, please feel free to forward this video to them.